America in 2025 faces a staggering crisis. More than 770,000 people are without a home, children miss out on classrooms, and thousands drift through every corner of city streets. Here in Minnesota, the cold brings its own urgency. Rows of tents under highway overpasses stand as silent testaments to lives in limbo. Beneath the glow of street lamps, fathers clutching children and seniors wrapped in borrowed blankets brave temperatures that plunge well below zero. This isn't the opening shot of a travel documentary filled with sun-soaked landscapes and exotic wildlife, but a raw glimpse into a crisis unfolding in America's northern heartland. Tourists still flock here for the land of 10,000 lakes and quiet forests. Yet thousands arrive at a colder reality. No warm bed, no permanent address, no certainty for tomorrow. On our channel, we've traced hidden wonders across the globe, yet this journey feels remarkably close to home. In this narrative, we focus on why warming centers overflow each year and what each data point represents in human life. State of homelessness in Minnesota. Minnesota has long prided itself on progressive social policies and a reputation for fair winters. Yet beneath that veneer lies a crisis of growing magnitude. By the end of 2024, the state recorded roughly 10,000 individuals experiencing homelessness on any given night, a rise of nearly 10% over the previous year. In Minneapolis and St. Paul alone, encampments have multiplied near riverbanks and beneath freeway overpasses. Community outreach teams count dozens of makeshift shelters dotting parklands and vacant lots. While local hospitals report patients arriving sick from exposure to frigid nights, across the state, Native Americans, though constituting barely 1% of the population, account for almost 1 in 5 people without homes, a disparity rooted in historical marginalization. Winter brings even harsher realities. Temperatures routinely dip below zero, and each season claims lives lost to hypothermia. Local warming centers operate around the clock. Yet the demand now exceeds available beds by more than 30%. Families huddle in small shelters designed for single adults, while veterans wait in lines stretching into the street. It is a landscape more fitting for a social study than any travel documentary, yet it is here, in America's breadbasket, that these human dramas unfold. This surge in visible homelessness is not confined to the Twin Cities. Smaller towns like Duluth, Rochester, and Mankato report similar patterns, parks transformed into temporary communities, food banks running on donations that barely keep pace, and volunteers overwhelmed by the scale of need. In Duluth, outreach workers describe abandoned motels repurposed into informal shelters, their neon signs blinking over tents that sprawl across parking lots. In rural counties, mobile units deliver blankets and snacks. But the distances involved mean help often arrives too late for those frozen overnight. The human toll behind these statistics is profound. Children in the foster system find themselves couch surfing before they turn 18. Seniors forced out of subsidized housing camps and tent encampments. Parents forego medical care to keep their families fed and warm. Each figure on a quarterly report represents a person navigating indignity and danger. Now that we've mapped the scale of this crisis, it's time to ask, what drives so many Minnesotans into homelessness? If you find this insight valuable, please like, comment, and subscribe to our channel. Your support helps us shine a light on stories that demand attention. Understanding these figures is just the beginning. Next, we dive into what drives this crisis. Root causes of homelessness. At the heart of Minnesota's homelessness surge lies a fierce imbalance between housing costs and household incomes. Rental rates in Minneapolis have jumped by nearly 30% over the last 5 years, while average wages for service workers and entry-level employees have crept upward by only single digits. As a result, many families now spend more than half their monthly earnings on rent, double the threshold recommended by federal guidelines. Tiny surveys of apartment listings reveal that even a modest one-bedroom unit can cost upwards of $1,200 per month, a figure unattainable for those earning minimum wage or relying on fixed incomes. Why has affordable housing become such a scarce resource in the land of 10,000 lakes? One factor is the steady conversion of low-income units into market-rate condos, driven by developers eager to meet demand from young professionals and retirees. Vacant lots once earmarked for community centers now give way to luxury townhomes, while city budgets struggle to keep pace with infrastructure needs. The result, a shrinking stock of homes priced for families earning below the area median income. The end of emergency COVID-19 protections in 2023 delivered another blow. Federal eviction moratoriums and rental assistance programs expired, abruptly removing critical safety nets. Thousands who relied on temporary subsidies or legal barriers found themselves locked out of housing markets overnight. In Minneapolis, the number of eviction filings surged in early 2024, with courts overwhelmed and social service agencies inundated by calls for help. But economics alone do not explain the full picture. Mental health challenges and substance use disorders affect roughly 40% of those experiencing homelessness in Minnesota. Yet public health systems lack the capacity to treat everyone in need. Waitlists for inpatient psychiatric care stretch for months, and outpatient clinics operate at full tilt. When beds are unavailable, individuals cycle through emergency rooms or sleep outdoors, a tragic revolving door that perpetuates instability. How can a community address homelessness when essential services run dry? Compounding these pressures, victims of domestic violence and LGBTQ youth constitute significant subpopulations among the homeless. In many cases, fleeing abuse means leaving behind homes with no safe alternative. Shelters catering to these groups are often the first to fill up, forcing people to seek refuge on city streets or in vehicles. Iowa's tiny home villages have been heralded as a model for providing dignity and safety, but Minnesota has only piloted a handful of such projects. The systemic roots run deep. Centuries of redlining and discriminatory lending practices have left Black and Native communities with fewer generational assets and less access to credit. Today, those disparities translate directly into higher homelessness rates among people of color. A Native family on a reservation may be just one medical emergency or job loss away from living out of their car. Recognizing these intertwined forces is crucial before any lasting solution can take hold. With those pressures in mind, it's time to examine how Minnesota's social welfare programs respond to this crisis. The social safety net in Minnesota. Minnesota's social safety net ranks among the most comprehensive in the nation, yet it strains under the weight of growing need. At its core sits the General Relief Housing (GRH) program, which allocates an average of $900 per month to help low-income adults secure housing. For many, this subsidy only scratches the surface of market rents, leaving them perpetually one paycheck away from eviction. Emergency shelter services offer another lifeline. The state funds over 130 shelters and warming centers, opening their doors whenever temperatures dip below a dangerous threshold. Yet these facilities operate at 90% capacity year-round, with peak demand in January often exceeding supply by 30%. In urban centers, families with children compete for rooms alongside single adults and veterans, while strict sobriety policies exclude those battling addiction. Temporary overflow shelters spring up in rec centers and churches, but their seasonal nature prevents long-term stability. Supplemental Nutrition Assistance Program benefits and medical assistance provide food and health care to qualifying households. Yet bureaucratic hurdles and documentation requirements bar many unhoused individuals from enrolling. Without a fixed address, completing paperwork becomes a Sisyphean task. Homeless youth shelters such as Avenues for Youth and The Link serve hundreds of young people each year, yet waitlists persist, especially for those identifying as LGBTQ. What happens when mental health services run out of beds? Local nonprofit clinics strive to fill the gap, but rely heavily on grants and donations that ebb and flow with economic trends. Mobile outreach teams distribute blankets, hygiene kits, and information about available resources, but they cannot substitute for comprehensive treatment or permanent housing. Volunteer groups and faith-based organizations play an outsized role in filling service gaps. Food trucks line up outside encampments, And community centers host pop-up clinics offering flu shots and counseling. Yet the volunteer spirit, while noble, cannot replace sustained public investment. Many advocates warn that Minnesota's reputation for progressive policy masks growing inequities in access to care. Having mapped the existing safety net, the next question is what action the government is taking, and it's coming up next. Norway. As any good travel documentary would show, shining a light on hidden corners often reveals the work being done behind the scenes to bring relief. In Minnesota, state and local governments have launched a series of targeted initiatives aimed at stemming the rise of homelessness and cushioning its impact on vulnerable populations. First, the Heading Home Minnesota Strategic Plan sets ambitious goals by 2028. Reduce chronic homelessness by 50% and ensure every family with children has access to stable housing within 30 days of losing their home. To reach these benchmarks, the state has increased annual funding for rental assistance by 25%, directing resources to those at greatest risk of becoming homeless, families with school-age children, seniors on fixed incomes, and individuals with disabling conditions. In partnership with 12 metropolitan and Greater Minnesota continuums of care, Heading Home deploys outreach teams to encampments, offering on-the-spot assessments and immediate housing placements wherever possible. Second, the Housing First model, embraced statewide since 2016, continues to expand. Under this approach, people exiting shelters or the streets receive permanent supportive housing without preconditions like sobriety or employment. Research shows that Housing First reduces hospitalization and incarceration rates by up to 60%, ultimately saving taxpayers money even as it restores dignity. Minnesota's Department of Human Services has committed to creating 2,500 additional units of permanent supportive housing by 2026, leveraging both state bonds and federal tax credits to incentivize affordable housing developers. Next, recognizing that prevention is often more cost-effective than crisis intervention, the Homeless Prevention Aid Program allocates flexible funding directly to counties and tribal nations. In 2024, over $65 million was distributed, enabling local governments to provide emergency grants for rent, utilities, and security deposits. Early data suggests that for every dollar spent on prevention aid, communities save an average of $5 in emergency services and shelter costs. Importantly, tribal governments in rural areas receive dedicated allocations, helping Native families avoid eviction and remain connected to their cultural networks. Besides, Minnesota has bolstered its shelter capacity by reconfiguring underused public buildings. In Duluth, an old armory was converted into a year-round warming center with 150 beds. Mental health counseling and job placement services. Hennepin County repurposed a surplus office block into a mixed-use facility housing both families and single adults, complete with an on-site clinic staffed by social workers. These conversions cost less and proceed faster than ground-up construction, offering a nimble response when federal emergency funds are available. To address root causes, the state legislature passed the Landlord Incentive Act in early 2025. This law provides landlords with risk mitigation funds, up to 3 months' rent, to cover damages or unpaid balances when renting to tenants exiting homelessness, by lowering perceived financial risks. The program aims to open up more private market apartments to those with limited credit histories. Preliminary reports show that 80% of participating landlords extended lease renewals beyond the initial year, indicating improved tenant stability. Despite these strides, gaps remain. Eviction filings rose by 12% in rural counties in 2024, and many supportive housing projects face community resistance rooted in stigma. The expiration of American Rescue Plan funding in mid-2025 threatens to cut 15% of current homelessness programs unless the legislature finds alternative revenue. These challenges point to the need for longer-term, sustainable strategies. Poor. While a typical travel documentary might gloss over policymaking, understanding sustainable solutions is essential to charting a path forward. Minnesota's next chapter hinges on bold investments, cross-sector collaboration, and community empowerment. Expanding affordable housing stock. To keep pace with demand, Minnesota must build or preserve at least 5,000 new affordable homes by 2030. This requires tripling the current annual production rate of low-income units. The state can allocate a permanent percentage of its general fund, 1% of annual revenue, to a dedicated affordable housing trust. Such a trust could issue grants and low-interest loans to nonprofits and community land trusts, which in turn maintain homes at below-market rents indefinitely. Additionally, leveraging public land, former schools, parking lots, and decommissioned government facilities can yield hundreds of build-ready parcels for mixed-income developments. Scaling tiny home villages and modular housing. Minnesota's first tiny home community in St. Paul proved that small-scale dwellings can offer safe, private spaces at a fraction of the cost of traditional construction. By standardizing modular designs and fast-tracking zoning approvals, municipalities could establish dozens of such villages, complete with communal kitchens, bathrooms, and social services within months. These villages not only house people quickly but also foster peer support networks that aid recovery and job readiness. Integrated health and social services hubs. Homelessness is rarely a standalone issue. Mental health, addiction, and trauma often intersect. Minnesota must co-locate services so that housing, counseling, medical care, and employment assistance operate under one roof. By eliminating referrals and transportation barriers, clients can receive all necessary support during a single visit, improving outcomes and reducing drop-off rates. Data-driven coordinated entry. A statewide homelessness response portal, accessible to every shelter, outreach team, and human services agency, would unify intake assessments and priority scoring. Real-time dashboards can track vacancies, pending placements, and demographic trends, enabling rapid resource reallocation when needs spike. Analytics can identify geographic cold spots, lacking services, guiding mobile team deployments, and informing where permanent assets should be built. Economic empowerment and workforce integration. Long-term stability often hinges on sustainable income. Minnesota can expand transitional employment programs that pay living wages while participants gain marketable skills. Partnerships with sectors facing labor shortages, healthcare aides, green energy installers, and urban agriculture can create apprenticeship pipelines directly from shelter programs. Earn and learn models, where wages and benefits are paired with housing subsidies, help participants save money and build credit. Community engagement and education. Eradicating homelessness demands broader public buy-in. State and local leaders should launch awareness campaigns, akin to environmental documentaries, that humanize housing insecurity and debunk myths. Schools can integrate service learning modules, and businesses can sponsor Adopt a Village initiatives supporting tiny homes or modular units. When communities see their neighbors helped rather than pushed aside, stigma erodes and grassroots momentum builds. Sustainable funding mechanisms. To avoid sudden fiscal cliffs, Minnesota must diversify funding sources. Options include dedicating a slice of document recording fees, enacting a small housing impact fee on new commercial developments, and establishing a voluntary payroll contribution program where employees can donate via paycheck. Such measures create stable revenue streams insulated from legislative shifts and economic downturns. These sustainable solutions, though complex, form an interconnected ecosystem: housing, health, data, and livelihoods, capable of dismantling the cycle of homelessness in Minnesota. Conclusion. Minnesota's homelessness crisis stands not as a distant headline, but as a lived reality for thousands who navigate frigid nights and uncertain days. We've surveyed the stark data, traced the economic and social forces at play, evaluated the strengths and limits of existing welfare programs, and examined both immediate government responses and visionary sustainable strategies. This story of crisis and hope underscores a fundamental truth: housing is not a privilege, but a cornerstone of human dignity. Turning the tide will require more than funding. It demands empathy, innovation, and unwavering commitment from every corner: state halls, nonprofits, local businesses, and neighbors alike. For every shelter bed open, there must be thousands more homes built. For every eviction prevented, countless lives can transform. The lessons here in Minnesota resonate far beyond its snowy plains. If a region famous for hospitality and lakes can confront its own shadows, so too can any community ready to invest in people. As you reflect on these realities, remember that real change begins when we choose to see homelessness not as an inevitable condition but as a solvable challenge, one travel documentary need not avoid but rather bring into full view.